So the doctor who treated everyone, board-certified plastic surgeon, Dr. Brian Kinney, joins us once again. So, Doc, one of the things that I'm interested in is the response from everyone seems to be more along the lines of just more tone. And it feels like they're saying they got to work out without really working out, which always sounds too good to be true. Are you happy with the results? And is that kind of the effect that you're looking for with this?
I'm happy with the results. I think they had a good effort and a good response. But I try really hard not to promise this, working out without working out and lifting and all that. I tend to be more science-driven. And what we noticed, we knew this device could tone muscle. And then we did our biopsies and we did our blood draws and we saw the chemical changes in the muscle. We saw the toning and bulking and building of new muscle cells. We were a little surprised in our original study for the FDA that we also were getting this effect on the fat. And so that's really the huge bonus, is that the decrease in the fat. You feel it immediately because it's a powerful set of contractions. We're only 2 weeks out from 2 weeks of treatments. It's been about a month since they started. We usually see the best results starting about 2 months post-treatment. So another 6 or 8 weeks from now, we'll see better results.
So if the average treatment for our testers, let's just say we went with 6 treatments, give us a cost range there.
$4,000 plus or minus, but it's no surgery, no pre-op, no x-rays, no blood draws, all that kind of stuff. You just can go in and get it done.
Big price point difference. I mean, you said about $4,000 for these treatments. Invasive surgery would be significantly more money than that, and the risk of surgery. So, I mean, I saw the results. I don't think they're as dramatic as you would get with surgical procedures, especially if diet and exercise are combined with it. So that being said, I think it's another option.
And I think the one thing before we go, and I'd be curious if one of you wants to speak towards this, because I am a big believer, and so I didn't want people to believe that you can work out without working out. But could something like this inspire you all to, get in there and do a little more body work when it comes to naturally building the booty or the abs? Are you all maybe a little more inspired than before to do that?
Absolutely. I went to my first Pilates class this past Monday because I knew, I could see the results. And in doing the reformer, I could feel just on the reformer that part of my butt start to lift based off of where it was actually sitting. So yeah, absolutely.
And any potential risk?
Risk could include any metal implants, pacemakers, insulin pumps, pain pumps, metal that would be in the field of electromagnetic conduction. So we don't want that. Titanium doesn't matter if you have a hip because it doesn't conduct electricity as much. IUDs that have metal in them, copper can't do it. We've had a few patients with C-section scars that have said, well, it hurts a little. We also have most of our patients that don't have a problem.
Well, we look forward to hearing more about the longer-term studies as well. I want to thank all 4 of you for participating. Dr. Kinney, thanks so much.
Thank you.